Hello, today's physiotherapy training is on standing frames. A standing frame is a piece of equipment used to support a person in the standing position. At the Eden Academy Trust, we use standing frames when a pupil is unable to stand unassisted. This may be due to weakness, or perhaps they have atypical muscle tone in the case of cerebral palsy, or any other challenges really that limits their independent standing or walking. A standing frame is composed of a strong, rigid frame with a wide base that will support the child in the standing position. Sometimes we call it a stander, and these are designed to help the child achieve a sustained standing, but in very, very good alignment. So the alignment of the body is very, very important, and that's something we want to get right from the beginning. There are many advantages to the use of standing frames. Here are just a few that we're going to mention. So, elevated position. From this position, when they're at a higher level in that standing position, a child has better eye contact, able to engage better with teachers, with whoever else is in the class, sometimes with other peers that are ambulant or walking, and without a doubt this will enhance their self-esteem. Standing can improve bone density. Now, the more the person stands, the more weight is going through those bones, the more minerals are laid down, and therefore the bone density increases, and this has a very, very good effect of preventing fractures, because fractures can be quite common. Standing frames help to reduce the risk of hip subluxation or dislocation, and this is common in children that have quite severe dystonia or high muscle tone related to cerebral palsy. Standing frames reduce leg spasticity. Now, there's often pain associated with leg spasticity, so it can improve pain levels too. Due to the sustained gentle stretch of muscles, joint contractures can be prevented and sometimes improved. Joint contractures are where joints can't be moved through their full range of movement. Because they're not moved often enough, they actually get quite stuck. If they're fixed, that means we can't do anything about it. But if they're not fixed, standing in a standing frame can improve joint contractures, make them much better. Standing frames work brilliantly for various systems in the body. So the breathing, circulation, bladder and bowel function, all of these are shown to improve with the use of standing frames. Improved hand use, as with the rest of the body supported, so the rest of the body is in a lovely stable position. Arms are now free, hands are free, and you have better ability to control your hands and arms when your body's that well supported. Skin health is improved too because you get pressure relief. Children often spend a lot of time in chairs, maybe lying down. It's lovely to have a change of position and go up into standing, which relieves the pressure in the areas that often get a lot of pressure. And very often it improves the child's overall sleep and well-being. So standing frames are very, very good for children. We generally recommend that they use them daily for an hour at a time. However, if they don't like them or they're uncomfortable or you're building up tolerance, you can slowly increase it over time, or you can separate it into 2 half-hour sessions. But research does show that you need to use it 5 times a week for an hour at a time for it to be effective. Right, we have different types of standing frames. Supine stander, prone stander, sit-to-stand stander, mobile stander, and multi-stander. You will be most familiar with the supine and the prone stander as we use these most across the Eden Academy Trust. But generally what happens is the physiotherapist, together with an equipment company's rep, will assess the child and decide what is the best stander for this child. And it very much depends on their physical needs and what they're able to do, the type of support they need, etc. Let's start with the supine standing frame. Now, the word supine means to lie down on your back. So although the pupil ends up standing, they're actually hoisted into this standing frame in the horizontal position, lying on their back. So the stander is put into the horizontal, the pupil is hoisted in, and then the stander is slowly moved to the vertical position using the controls. When a pupil's getting used to their stander, one would start by keeping them lying on their back at a slightly tilted angle and slowly progress this to the vertical as they become more comfortable. A supine stand is usually recommended when a pupil has extremely poor motor control and needs to be completely supported in the standing position. Usually they'll have poor head control and not be able to hold their head up against gravity, and in this case a supine stand is recommended. As mentioned, the pupil is placed into the stander in supine, so lying on their back. If a child has AFOs, ankle foot orthoses, or a spinal brace, please be sure to put these in place before the child is hoisted into the standing frame. Adjustable straps are placed around the pelvis, chest, knees, and feet. And once secure, the pupil is then moved into the standing position slowly. A tray is placed in position to rest the arms on. All staff members who assist pupils with these types of standing frames must be trained in manual handling training. Many of our pupils will have very complex needs, and in this case, you need to be signed off specifically for that child by the physiotherapy team. Once both the physiotherapy team, or the physiotherapist, and the staff member, him or herself, are happy with the member's competence, they will then be signed off to be able to continue with this independently. If at any point you feel that you can't remember what to do, you haven't done it for a long time, or you just feel unsure, please call a member of the physiotherapy team just to come. Even a member of the manual handling team can come and remind you, assist you to practice a bit, but to be signed off, you need to be signed off by a member of the physiotherapy team. Now, abduction standers are a type of supine stander. They hold the legs in an abducted position. Abduction means your legs are apart. Adduction, when you add your legs together, your legs are together. Abduction, legs apart. So holding the legs in an abducted position is often very, very beneficial because it aligns the top of the thigh bone. If you imagine my arm being the thigh bone, the top of the thigh bone, as you can see in the picture too, has a ball on it. So it aligns the top of the thigh bone, the ball part, securely with the hip socket, also called the acetabulum. So these two meet quite firmly when the leg is abducted, when the leg is out to the side. And this position supports proper hip socket formation and can help prevent hip dislocation in the future. Some standing frames do allow for this position, some supine standers. But please, it's important that only the physiotherapist adjusts the standing frame. Please refer any concerns to the physiotherapy team that you may have regarding any standing frames. Right, let's do the prone standing frame. Prone means to lie on your tummy, and although you don't really lie on your tummy, you can see that the weight is forward on your tummy, and that's why they've given it the name prone standing frame. These standing frames are usually recommended when a child has good head control and minimal or very little spinal deformity. Prone standers are very similar to supine standers in that they support the whole body, but they do so from the front of the body, not from behind the body as supine standers do. Most of the time, prone standers will have a tray on which to support the arms, and in fact, the child is encouraged to lean and support their arms on that tray. The support goes through the elbows and the shoulders. Prone standers are sometimes called upright standers if there's no inclined angle. If they're completely upright at a 90-degree angle, then because some of them can be set this way, these are called upright standers. But if they're slightly inclined, as the one in the picture is, then this is called a prone stander. You'll see there are hip straps, chest straps, knee cups. These are all fastened into position, and I think this is something that we will go into in the video where we show you how to put children into the standing frames, which straps to put in first. But all of these straps serve to hold the child in a nice, firm, supported but very comfortable position. You may know that there's often a lot of discussion around moving standing frames within the school environment. The decision to move standing frames in this environment depends on so many different factors. So the child themselves, what are their actual needs? What is the layout of the school? What is the level of mobility and independence of the child that's in the standing frame? Where do they need to be moved to? What is it for? Is it riskier to move them or riskier not to move them? Standing frames, we know, can be moved within the classroom. They can be moved within the hub setting. As you see, our two big green ticks, that is allowed. We do not want to move them across thresholds. We do not want to move them outdoors. However, if restricting the frame to these settings will cause a pupil to miss important parts of the curriculum or school activities, the physiotherapy team can definitely conduct a risk assessment. And if deemed appropriate, You can then move the standing frames into these areas under certain conditions. So if there is something you wanted to do with a child in a standing frame, please do approach the physio team. They can analyze, is there higher risk to them not doing the activity versus risk to them doing it in the standing frame? And more often than not, if you've thought through it, without a doubt, probably the physiotherapist will say, yes, that's absolutely fine. Let's put in place a risk assessment. But if they say it's not, please do follow what they advise. Obviously, we just want to keep the children safe and you safe too. Thank you so much for listening. I hope you found it interesting and helpful. Please remember, if you ever need a member of the physiotherapy team, email them, call them, just rather ask than do something that you're not comfortable with. There will be sign-offs that will be happening. Please be sure you are signed off, especially if it's someone you're not comfortable with. We're there to help you, and we want to keep you safe, and we want to keep our children safe. Thank you so much.